All right. Good afternoon, everyone. We are going to go ahead and get started. Thank you so much for taking the time out of your day to join us for our webinar. My name is Michelle Hahn, and I am the Community Programs and Events Manager for HealthLinks. And I really love being able to spend time with you all on these webinars each month to hear more about how our different partners and the business community are working to improve the health of individuals in all the workplaces throughout Colorado and in their own communities. So part of our goal for HealthLinks is to connect businesses to each other and to local resources and partners so that you can all continue to create a culture of health and safety in your own workplace. So today we've invited some of our partners from Tri-County Public Health to help us think about a really important issue, which is mental health stigma in the workplace. Before I introduce the speakers for the day, I just wanted to go over a few housekeeping items for you all. So since we are all on a Zoom meeting, we are just going to keep everybody on mute. That will eliminate any sound disruptions and any feedback. So if you have a question, you can simply use the chat box, which is in your control panel, or there's a Q&A box also in your control panel. If you type in a question in either of those places, we will make sure to address them either along the way, and we'll make sure that we have 5 minutes at the end for last questions for the day. We are recording this webinar, and we will share the link with you to that recording after the webinar is completed. You will receive an email that will include a PDF of the handouts of this presentation, a way to contact Monica and Patty, our presenters today, and then a link to the recording so that you can share it with anybody that you would like to, whether you have colleagues or friends that you think would really enjoy the information. So with that, I will introduce our speakers for today. We are joined by Patty Boyd and Monica Younger, again from Tri-County Health Department. Patty is the Strategic Partnership Manager at Tri-County, and in her work, it includes the implementation of the public health improvement plans for the Tri-County area. So that includes Adams, Arapahoe, and Douglas counties. And she really focuses on mental health promotion, and she believes that it takes partnerships to make a difference in the health of our communities. Monica is the Behavioral Health Coordinator at Tri-County, and in that role, she helps administer the SIM LPHA grant that was awarded to the Metro Public Health Behavioral Health Collaboration, and that works alongside Denver, Boulder, Broomfield, Jefferson, and the rest of the Tri-County jurisdiction. She has over 16 years experience in healthcare education, community mental health, and in public health. We are very excited for what they are going to present to us today. So without taking any more of their time, I'm going to hand it over to these lovely ladies.
Hi, everyone. This is Monica.
And this is Patty.
We're so happy to be here today to talk about one of our most important topics, which is mental health and getting people to talk about mental health. So we may go ahead and just let you know up front that this may be maybe like a 45-minute presentation. So if you have questions at the end, we can address those. We will talk about the campaign that we developed, and we're going to talk about how we did it without really much budget for paid media. And as Michelle said, we are working with the Metro Public Health Behavioral Health Collaborative. That's quite a long name. But basically, it's the group of metro area public health departments. So these are our partners, and everybody has had a great deal of involvement in developing this campaign. It's not specifically Tri-County, it's all of our partners working together.
So when we started would be more than a year ago, we brought together community partners that formed what we call the Message Action Team. And you'll see on this slide some of the team members along with our local public health partners. So this work was really the work of a community effort.
Okay, and this team, this Message Action Team, made up of all these folks who met diligently and got together frequently and developed all of our materials. First of all, they had the goal in 2017. The goal of the campaign was to reduce stigma surrounding behavioral health care so that people would go and seek care. It's not just getting people to talk about it for no reason. We really wanted to have the call to action be talk about it so that people will go seek care. So that goal was updated in 2018, and the new goal is to advance the Let's Talk Colorado message, because in 2017 we didn't even have the name Let's Talk Colorado yet, so now Let's Talk Colorado. The messaging campaign is to encourage people to talk openly about their mental health with others. The priority population was sort of given to us by our grant deliverables. We had to make something that was appropriate for the Metro Denver low socioeconomic adults and their providers in primary care and mental health care.
And I would just add, the one thing we've learned is that this message really crosses various populations, and we're actually delighted with that.
It's pretty exciting because it's not just, as you know, mental health doesn't affect people in one social strata. It affects everybody a lot around along the spectrum. And really, one of the things that we're learning about this work too in stigma reduction is that there's also stigma associated with providers. So we have to really think about everybody 360 degrees. So I'll just go over a little bit of how we developed the Let's Talk campaign, and this is probably relevant for anyone who's trying to start with something without a budget and needs to kind of come up with a campaign at their workplace or for their organization. So the first thing we did years before the campaign was even developed or before the grant was even written, Patty took it upon herself to sort of look out there to see what was already available, see what might be able to be repurposed. There was a lot of information on the Make It Okay campaign website out of Minnesota. So when we started working on this campaign, we sort of looked at that campaign and tried to figure out how it might inform what we were doing. The reason we did that was because it was very well done, it was very well evaluated, and it had a lot of good science behind it and a lot of backing from NAMI and some of the local hospital systems in Minnesota. So we felt like it was a really good, solid campaign that we could base our campaign on. Next, we got the message action team to come together and review some of these messages. And these people were helping us saying, well, this really resonates with us. This really would work for Colorado. This maybe doesn't work for Colorado so much. And so we had those discussions about what they really felt strongly about and what messages they wanted to implement in this particular campaign, and what messages that they wanted to send out to the focus groups to have the focus groups take a look at. So Evolution Communications helped us with that. They've been really instrumental and a really big part of the team. And they helped us with some of the focus groups. We got the messages together that we wanted to test. And then we also transcreated, not just translated, but we really wanted to make sure that we took those messages and made them make sense in Spanish in context. Then we created a communication plan so that people could actually take what we created and have a sort of a sample, sort of a roadmap as to how they might implement it at their place. And then we identified different dissemination channels. Again, because of the lack of a budget, we really didn't have a way to just start spreading the word via traditional media like television and radio and things like that. We couldn't take out a full page ad in the paper. So what we did was to go back to Patty's roots in public health, was to the grassroots messaging, where maybe back in the day you might knock on people's doors and do a clipboard, but now we would call them and email them and say, would you please help us disseminate our message?
And I'd just like to add a comment about the Spanish version of the website. It's potentially the only such website in the US that really has been transcreated in a way that frames the messages for Spanish speakers to make sense.
So we had a pretty successful year in 2017, and we decided to sort of revamp and retool things for 2018. And as part of that, and I don't know if any of you remember, but May is Mental Health Month, and we launched our first go at the Let's Talk Colorado materials May of 2017. So we're going to relaunch the newly revamped materials in May of 2018, and we're hoping that you see this as a great opportunity for you to also sort of incorporate this media and this message into your existing communication plan. So we have the two websites, and the folks at Evolution and the graphic designers and everybody is kind of coming together, and they're all putting things up on the website as we speak, so that things should be ready to go by Friday, probably midweek, but definitely in time for the May 1st launch. So some of the materials that are available, both in English and Spanish, include the video, the memes for social media, other social media content. So we have some sample Facebook posts, we have some sample tweets that people might want to use. We have posters, postcards, PowerPoint presentations, and then we have some samples of things that people might want to use in a newsletter, or people might want to do a press release around the May 1st proclamation. I should say that we're doing a proclamation. We're participating in a proclamation event on May 1st in conjunction with Mental Health America, or Mental Health Colorado. They've invited us to come and help kick off Mental Health Month on the 1st. So lots of different organizations are doing their own proclamations, but we're participating in the one at the Capitol with the governor, with Andrew Romanoff, who is the president of Mental Health Colorado. So we're pretty excited about that, and that's going to be kind of our signature event. And when I talk about the revamp of the website, one of the things that we're actually using to retool the website is some of the research that's been done by the Frameworks Institute. And they have helped us with helping us frame the messaging based on what experts want people to hear and how people best hear those messages. So that's why we decided to go ahead and make some changes. So some of the changes include changes to our key messages. So our first key message is to talk about our mental health. Pretty simple key message, but if you don't start with that, where do you start? So the subtext is sort of getting a positive definition of mental health. What is it? How do you describe it? How do we make it so that people understand that it's not just the absence of illness, but it's how we react, how the world reacts, how our mental health, how our mood, how our emotions impact how we react to the world. So that's one of our big key messages, and you'll see a lot of our materials will reflect that first key message.
And I would just like to add to that this has been really hard work, reframing a message based on the research, and we'll send the link to Michelle so she can send it out to the Frameworks Institute's research. It's really the first research of its kind done around adult mental health. And this is our first kind of take at taking that research and framing in a way that what we say is most apt to be heard.
Okay. And this is an example of how we used that first key message and incorporated it into some graphical elements. So again, you've got that positive definition of mental health at the top. It's that inclusive message in the middle. Mental health is more than just us. So you don't have mental health issues in a vacuum. It really does, you have interactions with other people, and other things in the world impact you. And then our message about asking for help, talking, and just really making sure that the message that it's very inclusive, and it's not just an individual's problem, it's kind of an issue that we all need to sort of work together to solve. And then our second message is that it's not just in our head. It's not just a brain issue. It's not just something that, the old model, I think, is that psychiatrists and psychologists and other behavioral health professionals deal with everything from the neck up, and then regular primary care deals with everything from the neck down. And we really need to start thinking about that. And that's one of the messages with the SIM grant that we're working on, is behavioral health integration is important. And it's important because mental health is something that we experience through our feelings, our bodies, and our minds. And if you guys, this is just a side note, but if anybody is familiar with the Mental Health America Mental Health Month Toolkit, that's kind of their big message right now that they're promoting, is that whole mind-body connection and how everything sort of works together. And that's their big key message for this year for Mental Health Month. And again, it's one of the things that we learned from our frameworks messaging training and research was that it's something that we need to really be inclusive about, and we really need to make sure that everybody is understanding that it's not happening as an individual. Mental health work and making things better really needs to happen as a group, as an agency, as a county, as a state, as a nation. We really need to think about how we make this work inclusive and not just up to an individual or it's an individual thing or a family thing. And then here's a graphic that sort of represents that key message. So we really want to make sure that every time we have a graphical element in the campaign, it's a reason to point back to some of the key messages. So again, very inclusive, sort of incorporating both of those first key messages. A, we all experience this every day, it's all of us, and B, it's important to talk. So that sort of incorporates both of those. And then we have the third key message, which is it's not something you can treat in a vacuum. So we're all, and this probably relates more to that Mental Health America toolkit. So it's all part of the bigger whole. It's very important to talk. It's not just a brain issue or a mind issue. It's just really about, as Carl Clark says, bringing our best self, or being the best self that we can be to the world. So we have a graphical element that. So we have this group, it's inclusive, it's about mind, body, life, relationships, all of those things that are important to consider. Not just thinking about the neck up. So one thing we'd really like to do is to share our video. And Michelle, this might be a little bit tricky because I don't think I can click there. I think I may have to click, oops. I may have to go to the YouTube link, and that's not a live link. So we can, do you think it's possible to actually have that link work?
If you have your browser pulled up, you just have to switch your window and switch to a browser and make sure that you're sharing your desktop screen so that we can see that and play it.
Okay, let's see what we can do. Bear with us for just 1 second while we pull up this video. And we're going to load it and try to get it going full screen. And
voice would be good.
I think it's playing on the computer. How about that, Michelle?
So you're gonna have to go back to your control panel and click on the share screen again, and you'll choose make sure that the green is highlighting the video and the internet browser rather than your PowerPoint. We still only see your PowerPoint.
Okay, here we go.
There we go. Perfect.
All right. How about the audio?
If you could turn it up, we cannot hear it on our end. Or put your microphone close to the computer.
I think it's coming from the computer that does not have speakers.
If you just want to put your phone next to it, whatever you're speaking into right now, if you can hear the audio on your end and you put your microphone next to it, we should be able to hear it too.
Actually, it's going to soon be done. We might just encourage everybody to visit the website and hear the video.
Yeah, that might just be a homework assignment for us, you guys.
That's okay. Maybe if you just want to highlight what the context of the video is and what how you share it with organizations, that might be helpful. And then to switch back to your PowerPoint, you'll go perfect down to your screen and click on your PowerPoint for screen sharing instead.
Okay, I hope we're back.
Yep, you look good.
So yeah, just a real brief summary of the video. And the video is a great tool to help people understand why it's important to talk. And it also gives some great examples of how to talk. So the video helps people understand why it's important, some things they might be able to say, some of the key messages. So it's just kind of a good thing to share out as you're sharing during Mental Health Month. So it's a tool that we have available to everyone to make that work. So we're going to move on to suggested opportunities. So you might be able to think of ways to incorporate the Let's Talk messaging, or you might use some of these. So we have a few ideas that we've used and that other people have used in the past that seem to work. Here are some just in this little laundry list. And so I'll sort of go through these one at a time. And then we can talk about this. So one of the ways that we talk about using the Let's Talk messaging is in incorporating it into customer service competencies for staff and volunteers. One of the things that's pretty interesting is the work that's been done at Harvard over implicit bias. And one of the things that we also discovered in sharing out the survey that's on the Let's Talk site is that people do uncover those implicit biases. People know that they shouldn't have stigma or that they think they don't have stigma until we sort of go to one of these tools, either the one at Harvard or the one on the survey, and really start thinking about honestly. And this is not something that anybody has to share with anybody else. It's not public. It's not recorded anywhere. It's just something as a tool that somebody can use for their own benefit to help think about those competencies around bias and how we treat people with mental health issues.
And I'd just like to share a story with that. In a work group I participated in, there were a number of physicians. And when we kicked off the campaign last year, I asked of that group if they didn't do anything else, at least to go and take that survey. And out of the group, 3 of the physicians approached me, 2 psychiatrists and 1 internal medicine, and they were surprised at their own biases. So we might think we don't have it, but they, we uncover that they do.
Yeah, so this is kind of just an interesting item, and it's not meant to be anything other than just a sort of a self-reflection type tool. You can use the Let's Talk messaging in your clinics or in your waiting areas or in your public spaces in your organizations. So we've made it really easy for people to download the posters and flyers and the other collateral materials from the website. And then those 3 key messages that we went over earlier, those are also things that you can take and incorporate it into your existing materials. And Patty and I are happy to talk to anybody who's maybe got a flyer or they've got something that they're working on and they would like to incorporate it somehow, and we can maybe help with getting other ideas, how that might work or how that might look or things like that.
And we'd actually really appreciate your ideas. If you have some process you've used and it's very successful, we would love to share that with all our partners.
And the worksite wellness programs. I know a lot of you have a very active, robust worksite wellness program in your organizations. So here's some ideas that might work for that. You might want to contact Mental Health First Aid to see if they can come out and do a class at your worksite. There are also lunch and learn opportunities around mindfulness, burnout prevention, managing conflict, and those are all ways that you can incorporate the Let's Talk messaging too. When we had the Mental Health First Aid classes here, we would also show the Let's Talk video at the beginning of each class. And that's something that we're hoping will be incorporated in more mental health first aid classes. You can implement a Let's Talk library. I know that we have at Tri-County have come across quite a few resources, books, videos, and you could maybe brand that as a Let's Talk library where people can contribute or check out different materials about mental health or talking about mental health or anti-stigma related topics. How about in your new employee orientation? You might be able to really point out to your new employees some of the benefits that they have around mental health. In a lot of organizations, when you talk about the EAP, people don't really know what that means. The Employee Assistance Program, it's quite ubiquitous. I don't know what the percentage is of employers that do the Employee Assistance Program, but it's really instrumental, and I think we've had some conversations here in our organization about how many people really appreciate and use that resource. Another thing that you might do as part of your materials that you hand out at an employee orientation is just like a one-pager with mental health or stress reduction resources. And I know that there's also going to be some efforts coming soon about how people might implement a mental health policy in their work site. And in this day and age, everyone has a social media plan. So you probably have a year-long plan that says where you're going to target, who you're going to target, and what kind of content you're going to put out. So what we've asked is if people have the ability or have the budget or have some sort of ways that they can incorporate other messaging, you can use it in social media. So when you're developing content around mental health issues, use our hashtag, include links to the What to Say page on the letstalkcolorado.org page, and also just celebrate Mental Health Month. And if you encourage employees to use social media, have them retweet your posts. You can retweet our posts. We're developing lots of things with the different counties in the metro area and strategies to really cross-post a lot of the things that we're putting out there.
And there'll actually be a tool on the toolkit that includes daily Twitter messages.
Yeah, there's going to be a lot of good stuff out there that you don't have to develop yourself. You don't have to reinvent the wheel, but you can just become part of the process. You might also use the Let's Talk messaging on public-facing promotional items. So yeah, I know in a lot of lobbies, maybe people have the big flat video screens where they can put up different messages, or you can have rotating messages maybe. And we do on the toolkit, we have a video screen card, yeah, slide, yeah, that you can use on a video screen like that. So, and then San Juan Basin Public Health, they're not part of our metro area group, but they are a group that has also embraced the Let's Talk messaging. And so they created a stand-up banner that sits in their lobby in Durango. So this is how they have chosen to take the Let's Talk messaging and not only promote the Let's Talk messaging, but also to promote their own public health department. So you see where they've had the San Juan Basin Public Health logo, or not their logo, but they have their name and their messaging and their contact information down at the bottom of that stand-up banner. Another thing that you want to keep in mind when you're doing any kind of a campaign is to think about when you start how you're going to measure the reach. How are you going to know whether you're successful with your campaign if you don't do some sort of evaluation? And we're not saying that you have to do anything magical or special or anything, but you kind of do want to know how it's going. And that's basically what this slide is about. So you can keep it simple. One of the things that we do is we keep track of all the social media posts that we do. So a lot of you might have communications folks in your organizations, and when they do a media campaign, they put up the social media, the Twitter messages, the Facebook posts, and then they keep track of how many times it was liked, how many times it was retweeted, how many times it was shared. So those kinds of impressions are important indicators for social media as to how well it's going. Some people might want to do a pre-post survey of their employees. So if you want to know, did this really change the way your employees feel or change the way they behave, you could say beforehand, do a little survey, even if it's just 5 questions about how they feel about mental health stigma, and then afterwards maybe ask the same questions and see if there's any differences in the numbers. That's another way of kind of keeping track of what's going on with your campaign. And then also keeping track of how many events featured the messages that you wanted to highlight. So we're talking about if you had something out at an event, or if you had a table at an event, or if you were doing some sort of collaboration with another organization and you brought some materials, how many of those events featured the message that you were trying to get across? So did your message get out X number of times? So that's just another way of doing a measurement of how it's going.
And I would like to share our reach for 2017. Given we started our campaign in May of 2017, we had a total impressions of 45.7 million. So that was the number of times hashtag Let's Talk showed up in an article, or were shared, were on Facebook. So we'd love it if you'd share out. We'd like to double that number.
Yeah, it'd be great if we could all work together and really cover the state with this message. So for our campaign, some of the next steps are going to include continuing to refine and update the campaign. I mean, the more we know and the more we can make it better, the reach is just going to be that much better. We want to take into account all of the feedback we get when we update the campaign, and we really want to make sure that we're honoring the wishes of the MAT team, the message action team that created the campaign. We also want to develop a plan for the distribution of messaging to target the primary care population. So the primary care population is really working and getting better at integrating behavioral health into the practices. So we want to help them with that. How do you integrate behavioral health care? How do you get this anti-stigma messaging into your behavioral health realm. And then we're also going to go back to the message action team and say, all right, we're doing really well, we're gathering steam. How are we going to work for year 3? And anyone would do this when they're doing a communications campaign. You'd sort of regroup at the end of the year and say, okay, what worked, what didn't work, how are we going to plan for next year? So this is probably going to take place this fall, this winter, so that we're even better for next May. And with that, I'll just ask if anybody has any questions.
Great, thank you. Nothing has popped up yet, but thank you both for taking the time to present today. And I just wanted to thank everyone on the phone for joining us again. And while you're thinking of questions to ask, just wanted to highlight once again the importance of why we brought Patty and Monica here to give this presentation, just to provide you with more tools and resources at your fingertips, because we know that mental health is a huge issue that needs to be addressed in all of our workplaces, and we all experience it in some capacity, and knowing how to talk about it in our workplaces is sometimes a bit scary and hard to know what the right conversation is or where even to direct people to get good information. And the EAP programs within that most people utilize are great to access, but it's getting people to actually go there and use them in the first place that can be hard. So I think these tools are really important, and the messaging has been targeted towards organizations and businesses to use that are easy to understand. So hopefully you can walk away with this great information and be able to use it for your own campaigns. And like they mentioned on the phone, we try to highlight what's happening each month. And May is Mental Health Awareness Month, so we'd love for you to think about promoting mental health in your workplace, and whether that's doing a lunch and learn or engaging in this conversation. We just love to be able to see everybody engaged and see what you're up to. And then some questions are coming in. Monica and Patty, when you find out about the mental health policy ideas, can you share with me so that we can send it back out to this group of participants when they're ready to go? Or do you have policy ideas for people to use in organizations of how to incorporate mental health?
Yeah, there is work being done in that area. All Health Network has actually hired a consultant to look at what those policies would look like. You know, it is like having an employee assistance program, having people, you know, you can actually take a mental health day. So we can, as soon as we have access to that, we'd be glad to share it out. And if anyone on the phone has some policies that they think work well in their organization, we would really appreciate looking at those too.
Yeah, and as a reminder, I will have in the follow-up email after this, there will be a link to the Let's Talk Colorado website, and then direct email contact information for both Patty and Monica, so you can send that information to them directly, any stories that you want to share, and any other specific questions that you may not be thinking of right now. But as you look through the materials and read through everything on their website and have questions about how to utilize it in the best way, feel free to reach out to them.
And Michelle, we will also send you the link to the Frameworks Institute, the research they did. We actually got a grant from the Colorado Health Foundation, and they did that research here in Colorado. And it's the first of its kind around adult mental health. So there might be some folks that would really kind of like to take a look at what that looks like.
Great, thank you. And another question, you mentioned at the beginning of your presentation that you will be participating in the proclamation at the Capitol here in Denver. Do you have any idea if there is a website that people can go to and see if those types of things are happening in their own community? We have a lot of participants from all different regions of the state, and not all of them may be able to make a trip down to the Capitol for the same proclamation. But if they want to be involved in something like that, is there a way to direct them to a website or find out how they can access that information?
You know what, we'll send you the link to Mental Health Colorado. because they're part of their work is they have key players in various regions of the state, and that would probably be the best resource we'd have at this time.
Okay, great, thank you. And that information for the Denver specific people on the phone today, if they want to know about the proclamation happening at the Capitol, they can go to that same website and get all of the details for it?
Yes, it's May 1st at 11:45 to start at 12 to go to 12:45. And we don't have an agenda yet. It hasn't come out of Mental Health Colorado yet.
Okay, thank you. Are there any other questions or comments that anybody would like to make on the call here today?
I would also add that if there's an organization in a part of the state that's a little bit further away from Denver, and if they have a good relationship with their city county government or maybe a prevention coalition, they may want to come up with their own sort of celebration on mental health month, so to kick it off on May 1st. So you could definitely get together with your city government, the mayor's office, have them sign a proclamation, get the media out there, get your local radio stations and newspapers to really cover it, and really maybe even get some of the local school groups involved, and it'd be a great civics lesson for kids.
Great idea, thank you. Great, I don't see any other questions coming in today, so we'll give everybody 20 minutes back in their day. Again, thank you so much for taking the time to join us, and thank you, Monica and Patty, for providing this great information for us. You'll be receiving an email from me shortly with all of the materials that we talked about today, and we hope to see you during our next webinar, which will happen next week on April 10th. So April is Financial Literacy or Financial Wellness Month, so that one's focused more on financial health and well-being. So if you want to join that, you can find that information on our training tab on our website at healthlinkscertified.org. All right, everybody, have a great day.
Thank you.
Thank you.
Thanks, Michelle.